So over the next hour, we're going to share more about T1 International and our work, hear stories about why patents are so important, and share some upcoming opportunities to take action before answering all of your questions. So please keep using that chat. I'm seeing lots of folks have figured out the chat. Put your questions in the chat as we're going, and we'll try to answer as many of them as we can at the end. So let's dive in and get started. I'm just gonna take my screen down because there's a lot of stuff going on. But yeah, hi everyone. My name's Shayna Casper. I use she, her pronouns. I'm T1 International's executive director. I've lived with type 1 diabetes for over 12 years now, and I was part of the diabetes community for about 5 years before that when my little sister was diagnosed. I live in Vermont in the northeast corner of the US, and I got involved with T1 International because, like so many of us on this call, I have gone to pick up my insulin prescription and was turned away at the pharmacy counter because at that moment I couldn't afford it. And I was so ashamed and frustrated that I didn't even think to ask for help. And it wasn't until months later that I realized what it was that I had done, that I had rationed insulin. And I didn't know at that point that there was really community for me. So much of the community for diabetes that I saw was funded by big pharma. And, despite insulin being discovered over a century ago, having only three insulin manufacturers, what we call the big three, controlling over 90% of the market, that means that they control the access to what we have as patients, to this life-sustaining medication. And I wanted to fight back against this abusive system and to find real structural, meaningful solutions to this insulin access and affordability crisis. So, after 10 years as an organizer in the environmental health world, I joined T1 International in policy work about 3.5 years ago. So, let me share my screen again and just go over here about what is T1 International. So at Do International, we believe in a world where everyone with diabetes should have everything that they need to survive and achieve their dreams, right? Not you guys with me? Sounds like a good vision, good mission. We support local communities by giving them the tools that they need to stand up for their rights so that access to insulin and diabetes supplies becomes a reality for all. And so we are patient-led, we are independent, we're transparent, inclusive, bold, and hopeful. So let's just sit with those values just for one sec. What of those value, what is one of those values that's resonating with you today? If you want to put it in the chat. And welcome to those who are just joining. If you want to introduce yourselves in the chat as well. Bold. Heck yeah. We're taking action. Yeah, I'm seeing a couple. We're independent. We don't take pharma funding. All right, I'm seeing patient-led and hopeful. Feel free to put more about why these values are resonating with you today in the chat as well. But I'm going to keep going here because what do we do at T1 International? I'm going to start with just a little bit of information about our advocacy campaigns, our actions, how we work, before I'll hand it over to Cindy to share more about why working on patents is so critical for insulin access and affordability. And then we'll go into more of the policy with Barrett and with Kristen. Okay, I'm seeing lots of great notes here. Care about our rights, supporting communities, standing up for themselves. It's awesome. Okay. So, based on T1 International's policy analysis, in order to achieve our vision of a world where no one has to go without insulin anywhere in the world, can have everything that they need to survive and achieve their dreams, we need to win the following policy goals. So, first of all, no one should be spending any more than 5% of their income on insulin and testing supplies. This is not the case for so many folks in countries all over the world, including for so many right here in the United States. In a few weeks, we're going to release a report on our out-of-pocket expenses survey that shows that over 30% of people are rationing insulin and over 50% of people are rationing glucose self-monitoring supplies. So access to affordable insulin is so critical, and it includes work at the global level, at the World Health Organization, at the country level, including a price cap on insulin. And in the US, we also do work to support the implementation of ALEC's law, which mandates that pharmacies provide emergency access of insulin to those in urgent need. We also work to challenge big pharma's monopoly power. So we advocate for transparent drug pricing, for patent reforms, for robust competition. So that includes public pharma, which will enhance drug affordability and access all across the globe, as well as patent reform, which is what we're going to be talking about today. We also think that everyone deserves access to quality and equitable healthcare. So including, for example, expanding pharmacists' scope of practice, which we call Kevin's Law in the US, and enhancing timely access to insulin and other essential diabetes medicines and supplies all across the globe. So how do we do this work? We believe that in order to win these policy goals, we need to take these actions. So first, we need to run targeted and strategic advocacy campaigns. So these are campaigns that mobilize a diverse community and bring together different groups to take bold grassroots action at every level, from local meetings with policymakers to holding global mobilizations like World Diabetes Day. We know that every action counts. The second thing is that we must build strong, supportive connections with partners and with others across our movement who share our vision. We know that we're stronger when we work together across organizations, across countries, when we center community-led work, community-led research, and the experiences of those most impacted. That's how we win. Third, we work to empower strong local groups to lead the fight where they are. We have Insulin for All chapters all across the globe. Raise your hand if you're a part of an Insulin for All chapter. Every community we know faces different challenges, and by tailoring our efforts to our local context, we can build movements that are rooted in that local context, but that are resilient by this connection and are unstoppable. And so we're really committed to building supportive communities for those most harmed by the unaffordable cost of insulin and by fostering strong leadership through authentic relationships. So finally, we just, believe across all of this in promoting leadership among those most impacted by the insulin price and accessibility crisis. So it's not just about telling stories, but it's about taking action and putting impacted people at the center of everything, from our campaigns, our leadership, our teams, our communications, our media. We're just always grounded in our ethical patient engagement principles. So we do this in a couple of different ways. We have dozens of Insulin for All chapters around the globe. We have working groups, like our federal working group that is leading today's webinar. We have Families United for Affordable Insulin, a group made up of those who have lost loved ones due to insulin rationing, who turn their grief into powerful action. And we have Insulin for All advocates. So that's everyone on this call today is an Insulin for All advocate. We are taking action together all across the globe through mobilizations like this one that we're launching today. So that's going to be it for me for a little while. I'm going to turn it over to Cindy. Cindy is a member of our Families United for Affordable Insulin, and she lives in the Twin Cities in Minnesota. And just a quick content warning is that Cindy is going to be speaking about the loss of her child, which may be distressing. So I'm going to take it away, Cindy. There we go.
Okay, thanks, Shana. Yep, my name is Cindy. Again, I'm in Minnesota. And my son Jesse died on June 28th, 2019 from ketoacidosis. Jesse was a really cool kid. One of my favorite things about him, or one of my favorite memories, is him being on the bus on the way to preschool. We used to take a city bus downtown, and it would be really quiet. It would be early in the morning, people on their way to work, and he would just burst out singing at the top of his lungs. He loved to sing. He was a really good singer, and it really made our day. He also even got to sing the national anthem with his choir at a Twins game, so that was really special for our family. Jesse was also really good in sports. He played baseball, basketball, soccer. Soccer was his favorite. But one summer I noticed that he was drinking a lot of water and losing weight. And it was a really hot summer. So at first I thought maybe it was just that he was, because it was so hot, he was working harder at his practice maybe. But then I started to get concerned. And so I did some research on the internet with his symptoms. And I thought that it was possible that he had diabetes. So I immediately made an appointment with his doctor and expressed my concerns. And that was the day that we found out that Jesse had type 1 diabetes. It was also the start of many, many appointments and countless hours of education. It changed our lives forever. Diabetes is an expensive disease. That was one of the first things that the educators told us, and they were right. Financially, it was tough, and sometimes we did without certain things, but we always made sure Jesse had what he needed. When Jesse was 20, he decided to move in with friends, and it was I was worried, not just because of his diabetes, but because he was going to have more responsibilities and just normal things that you worry about as a parent. But it seemed to be going well. He liked his independence. He was with friends, and so I felt good about his move. Um, the day Jesse died was the worst day of my life. I was at the Mayo Clinic with a friend. He was doing chemotherapy. He had cancer. It was a really long drive to the Mayo. We knew it was going to be a long day and a really tough day emotionally. And while he was in his procedure, I was in the lobby and I tried texting Jesse, wasn't getting a hold of him. And when my friend came out, he said, "Oh, don't worry, Cindy. Jesse's 21. He probably doesn't want to be bothered with his mother. I would just give him some time." But my gut told me that that wasn't the case. And so I started making phone calls. And when I finally, on the drive home, got a hold of his roommate went to check on him and said he's barely breathing. And I know now that that wasn't the case. He really wasn't breathing at all. Um, it took 45 minutes to get him to him, as long as 45 minutes of my life. And we found Jesse there with an empty pen and an empty bottle of insulin and no insulin in the house. And it was a tragedy that should have never happened. So after going through the grief of losing Jesse, my anger set in. I knew Jesse had rationed insulin in the past, and I thought back to that conversation I had with the nurses and staff and thought, why is diabetes such an expensive disease? I believe diabetes is expensive because the drug pricing system is a system driven by greed. The companies that manufacture insulin make millions, if not billions of dollars on diabetes medications and supplies. And one way that they drive up the cost is through the misuse of patents. Patents are really designed to encourage innovation. And they're using these patents by overextending on older drugs through making minor changes to formulations or delivery devices. This patent misuse has really limited competition and made it difficult for generic manufacturers to enter the market. When insulin was discovered, the patent was sold for $1 because the inventors thought that it belonged to the world. To charge such a high price is really a violation of human rights. I once heard it described that insulin is as important as the air we breathe. And imagine if air was patented. It would be unethical. Would only the wealthy or privileged have enough to survive? Would people ration their air, try to learn how to hold their breath, or contain some for future use, hoping that it would still be good when they need it? Imagine how scary it would be. And insulin, like air, plays an essential role in maintaining life and should be accessible to everyone who needs it. It is unethical to charge such a high price for something that is a necessity, where without it can result in significant barriers to proper treatments, health problems, or even death. Jesse died from rationing his insulin, and he is the reason why I fight for insulin to be accessible and affordable for all.
Cindy, just huge love. I'm seeing some love on the screen. If anyone wants to share some love in the chat. Thank you so much for sharing that really, really meaningful, powerful story. It's just such a huge reminder about why we're here, about why this work matters. Um, I know we're all just going to be carrying Jesse in our minds and our hearts as we transition to this next piece and as we're taking action on patent reform. So let's just like take a quick collective breath together. Not a quick, we'll take a collective breath together. So if everyone wants to breathe in and out. These realities are really difficult and are just so essential to face. Jesse's story is why our work must be urgent and relentless. So thank you, Cindy. Now, to help us understand more about the barriers and opportunities ahead, I'm going to hand it over to Barrett. And Barrett is our genius New Jersey chapter leader, gem of a human. Take it away.
Thank you, Shana, for the high praise. I'll try to live up to it. And thank you, Cindy, for always being so willing to share your story. I am always moved by it. And Jesse's story is such a moving example of how necessary it is to address the current insulin access crisis. Good day to everyone who's visiting us in the present and anyone from the future who may be watching the recording. I am Barrett Ziegler. I am the New Jersey chapter lead, and I've been a type 1 diabetic since my early teens. I've been active with T1I for a couple of years now and was part of our action down in DC, where we met with legislators to discuss the importance of patent reform in curbing the cost of healthcare in America. So I am very excited to talk with y'all about patents tonight, and I appreciate you all spending your valuable time with us here on this very important topic. Broad picture first, what are patents? Patents are a form of intellectual property, or IP, and they are protected by federal law. You may know some other types of intellectual property, like copyrights, or trademarks, or trade secrets. And then there's patents. Copyrights, you may know, cover written works like books or song lyrics. Trademarks cover icons. Think the Pringles man or the KFC guy. Trade secrets include like formulations of things. Typically, we think of this in like the food world. Like think about the formulation of Coca-Cola or Pepsi. That's a trade secret. They're not going to patent that because then everybody will know about it. And then patents protect specifically inventions and what are called innovative processes. Um, Namely, the United States Patent and Trademark Office says that a U.S. patent gives you the right to, quote, exclude others from making, using, or offering for sale an invention, or importing it is the other one that I was forgetting. So U.S. patent protections allow you to sue someone who is infringing on your patent. That is when they make and sell or import the good that you already have a patent on that you're protected by. Patent protections can also vary between the type of invention that is patented. Utility patents have a patent term for up to 20 years. A design patent is for up to 15 years. The difference here is that a utility patent covers inventions that are novel and useful. In the context of diabetes, this would be something like a new formulation of insulin, such as a new iteration of Novolog or Lantus. And a design patent covers how a thing is built and how it operates. This covers things like ergonomics on your insulin pen or the technical interface on your pump screen. Even redesigns of old equipment like blood pressure cuffs is a pretty common one. But like like I was saying, this would cover designs of pens or cartridges that would go into the pens. These physical aspects of what are largely the DME side, the durable medical equipment side of diabetes. So why would you patent? Well, it was originally thought that patents would promote the public interest. It would prevent competition from developing similar formulations and encourage people to innovate, encourage people to solve many more problems because they're protected in their profits. Their research investments were protected by this guaranteed period of 15 or 20 years that they'd be able to be the only ones profiting off of this patented thing. It would also encourage companies to come forward and share what their patents are with the government because the government is the one providing those 15, 20 years of protection. And then after that period, the the patent would be widely available, and so there would be competition. It would drive the prices down. It would provide more abundance of the good. So since they're available to the public in theory after 15 to 20 years, um, why have we not seen this with insulin yet? Insulin was discovered over 100 years ago, and the first patents have already expired. So why are we not seeing this benefit of the patents? Before we go on to speak a little more about the problem with patents and the history of insulin, Shayna, I believe we have a slide for this. Yes, I want to make sure that we all know what patents are. And in fact, I don't know what a patent is. I have 4 projects of my own that I want to protect from competition, and I don't know which one would be covered by a patent. I have an upcoming novel called The Most Elaborate Charade. I have a design for a company mascot called Turpin the Turnip. I also have this self-constructed slow cooker I made in my garage that runs exclusively on solar energy. No big deal. And my friends rave about my secret recipe for a New Year's salad Olivier. So obviously, I want to profit off of all of these, but what can I patent? Going to give people a few moments here to answer it in the multiple choice.
Got about half answered. You should see it up on your screen. I'm going to count us down. 3, 2, 1. There we go.
Yeah, I love seeing the participation here. Almost everybody voted. And 71% got C. It was a slow cooker. That was a novel and non-obvious design of mine. Uh, for the just to like review, a novel would be something written, so it would be covered by copyright. The design of a company mascot is would be a trademark, and my secret recipe would be a trade secret. But most of you got the right one with the patent, and that is what will lead us into our next discussion. This is us in DC at the Smithsonian, I believe, reviewing some artifacts of the history of diabetes. Everything from the early 20th century formulations of insulin to Lancets that we've all probably seen and used at one point. Uh, as some of us may know, on January 23rd, 1923, Banting, Colip, and Best were awarded a U.S. patent on insulin and the method used to make it. They all sold these patents to the University of Toronto for $1 each, 3 total. And Banting famously said, "Insulin does not belong to me, it belongs to the world." I am just going to check in on chat for a moment here. I don't see any questions, so we'll move right along. There are 4 main ways that we see big pharma abusing patents, and these terms of art are called evergreening, patent thickets, there's product hopping, and pay to delay, or what is also known as killer acquisition. Evergreening is the practice that, Shana, you can tap the slide. Yeah, you're fine. Evergreening is when big pharma files multiple patents for minor variations of a drug or related product, like an insulin device or a formulation of insulin. This practice delays introduction of more affordable alternatives, keeping prices high. So by making minor changes without actually changing how something functions, they get to prolong that patent on that object, because it's not like they're actually patenting a new thing. They're just extending the patent on the thing that they already have. And so if we have a formulation of Novolog that has only like 2 grams of sodium in it, let's bump it down to 1 gram. That's a new Novolog. So we can discontinue this old one, and now we've got a fresh new patent on this. Same thing if they bump it up or down, just as an instance. Patent thicketing is when pharma files multiple patents on the same device, but also across devices. So that even if one patent on one device is successfully challenged, that same type of patent is covered by another device. So it raises the cost to challenge patents, and it's difficult to identify every possible patent that would be applicable to a certain medicine or device. Common instance of this is the plunger that works in your insulin pump or your insulin pen. That the patent could be on the pump and on the pen, but you're challenging it on the pump, but it's still available for the pen. And so they cross patent so many different things, and it creates this thicket, hence the name, that makes it very difficult to challenge even minor instances of a utility or a design patent. Product hopping is less about the patents and more about kind of the ecosystem that our healthcare is in. Product hopping is when insurers and pharma push patients off of their current medications in favor of the newer, more expensive ones, even if there is no improvement in treatment. Think of this in terms with the evergreening, where they're discontinuing the 2-gram Novolog and now have the 1-gram Novolog. And now that the 1 gram's on the market, this is a higher generation drug than the previous one. So pharma, through marketing strategies like coupons and rebates, encourage the use of these costly coupons with a very low upfront cost. They're offering this hot, fresh new drug for $100 less than you're usually paying. Isn't that great? Well, not when not when they discontinue the rebates, right? You need to go back to your doctor, get a new prescription for the drug that was better covered. And who's got time for that? Insurance companies also complicate this matter with prior authorizations and having those formularies in place that do prefer the newer, more expensive drugs, the higher generation drugs. Finally, there's pay to delay and killer acquisition. This is anti-competitive at its base. Even if something isn't patented, if pharma wants it, they have the money to buy it. The term pay for delay is when a competitor is about to go to market with a similar drug and pharma pays them to not sell that drug. It's extremely expensive for pharma to pay off its competitors like this, but they make so much more money off of the monopoly that they maintain that it's a no-brainer for them. Alternatively, when a company doesn't want to agree to this bribe, basically, pharma has the resources to buy out this competitor. And as the new owners of this competitive medicine, they can shelf that product or gut the company entirely and sell off the pieces. That is what a killer acquisition is, when pharma buys out a competing company to prevent any competition from entering the market. How does this hurt people with diabetes? Well, by limiting access to how to make insulin and the formulation of insulin, it creates this artificial scarcity where nobody's making it, because if they try to, pharma is going to sue them into the ground. Limiting the competition creates this monopoly, allowing the big three to make their own prices. I don't know how many people knew this, but there are only 3 producers of insulin that operate in America. And these 3, Novo, Sanofi, Eli Lilly, cover about 80%, 90% of the world's market on insulin. They can set the prices. And then by evergreening their formulations, everything that was meant for the public to know by now so that we can all make is just unjustly protected. And so between their deep pockets to defend the patents that they already have and the deep pockets to keep patenting stuff that they're already selling, it's bad all around. So I'm going to just check chat real quick just to see if we have any. Oh, Katie, literally getting lost in the weeds. Love that. Insidious, Animus. Yes, exactly. Great. So we're going to have a couple scenarios that diabetics could face that would be implicated by these patent abuses. And so over the next couple scenarios, I would like y'all to identify which type of patent abuse is at play. The text is on the screen. It's in the question. I shall give you a dramatic reading. I have been on Lantus for years, and I've watched its price go up over and over again. Lantus is made by Sanofi, one of the big 3 insulin manufacturers. In 2016, I read in the news that Merck was going to sell a biosimilar version of Sanofi's Lantus. I was so excited. Maybe I wouldn't have to ration my Lantus as much. But then Sanofi sued Merck, and Merck announced that they would no longer pursue Atlantis biosimilar. What patent abuse is here? Let's give y'all like 5 more seconds.
All right, 3, 2, 1. Last votes.
Great. I see, overwhelmingly pay for delay. Um, I love seeing that. Um, and the participation too. Like so many of you are chiming in. Let's go to the next one and see what that is. I have been on Lantus as my long-acting insulin since I was diagnosed. The drug is old, and the original patent on it has long expired. And yet, patent holder Sanofi, one of the big three insulin manufacturers, has made extensive efforts to extend their monopoly. They added stabilizers and they got another patent. They put it in another type of injector pen and they got another patent. What type of patent abuse is at play here?
Shall I count us down, Barrett?
Yeah, sure. Let's
All
give it
right.
5, 4, 3, 2, 1. Polls are closed.
There we go.
And yeah, patent evergreening. This is like that scenario I was explaining before by raising or lowering, like in the instance I use sodium, but here they're saying stabilizers, and then they also modified the design patent so that they could further extend beyond that. Let's go to the Oh, let's see. How does that work if they put it in a new injector pen, but it's also available in vial? That's a good question. So before I was speaking about the difference between like a utility and a design patent, they're two different patents. And so when they patent the new Lantus with the new stabilizers, that's a new formulation. And so that's a new um, utility patent. When they change the design of the cartridge, that's an ergonomic or a physical design thing, and so that gives them a new design patent on that instance of Lantus. So even if they redesigned the vial, that redesign of the vial is a new design patent that would give them another 20 years on that vial of Lantus insulin. Does that make sense? Awesome. Love the questions. Love the questions. All right. Our last one. We're almost through overthrowing Big Pharma. I went to fill my Humalog prescription, and my pharmacist asked if I was okay getting Lumjev instead. Lumjev, like Humalog, is a short-acting insulin Lispro made by Eli Lilly, also one of the big three. Because my copay was the same price, I thought I would try Lumjev, as the pharmacist said it was even faster acting. However, I got a new job, and my new insurance did not cover Lumjev. I had to go back to my new prescriber. I had to go back to my prescriber and get a new prescription for Humalog. But I had just started a new job and couldn't take any time off yet. So instead, I had to pay the full list price of Lumjev, which was so much more expensive than my Humalog. What type of patent abuse is here? I'll give you guys 10, 9, 8, 5, 4, 3, 2, 1. Let's cut it. And yes, this is the product hopping. This is the rebates. These are the discounts that pharma offers you. And then, like I said before, who's got time to go back to your prescriber? Like, I'm already seeing you every 3 months to get my A1C looked at. Like, I can't even take out time from work because then I would put my insurance into jeopardy. Oh, so I think that's my time. Uh, if there's any other questions, you guys can hold on to them till the end or throw them in chat and I'll try to address them as I hand it off to Kristen. So thank you all for bearing with me through this dense material now. And yeah, I'll pass it off to our inspiring advocate from Connecticut. They're all
Thank
yours, Kristen.
Thank you, Barrett. I think everyone enjoyed your very dramatic readings, made patents enjoyable. I'm Kristen. I've had type 1 diabetes for 19 years now. I also live with other chronic illnesses and physical disabilities. And I think the important part that we're going to talk about now is some of the solutions. You know, patents are a dense understanding and take a lot of time, but it's important to know that there's a way that we can address it. But why do I care about patents? For me, it's because I now know it's part of the reason why I rationed insulin. When I turned 26, I came off my parents' insurance, and I'm sure this is a familiar tale for many that I didn't quite realize how bad the insulin pricing crisis had gotten. And I couldn't afford my insulin, so I started reducing how much I was taking until I got to the very, very, very last drops of my vial. During this experience, I felt incredibly alone and ashamed that I couldn't pay for my life-saving medication. Several years later, I found out about T1 International and their advocacy on Twitter, and I finally realized that I wasn't alone in this experience. In fact, so many of us have experienced this. It made me realize that it wasn't a me issue. It wasn't a personal failing issue. It was the system failing us. I mostly stayed on the sidelines watching this advocacy until a tweet in 2018 asking if there were any volunteers in Connecticut. From there, I went on to found the Connecticut Insulin for All chapter and later joined T1 International's Federal Working Group. And I'm so proud to have been a part of this organization for 6 years now, fighting alongside amazing advocates such as all of you. And one of the things I really, really appreciated about T1 International was that one of the first things I learned as an advocate was the reasons why insulin is so expensive. It wasn't jumping straight to the solutions. It was really getting to know why this was happening and what changes we needed to make and how we got there. Thanks to Barrett, we got a really, really good lesson about the different reasons keeping insulin prices high. And then I think Cindy really drove it all home and that she helped remind us about our why. Our why is so critical. And that's why I always try to remember it when I walk into every advocacy meeting. I think about the people that surround us right now. I think of stories such as Cindy's. And then I go in and try to kick butt with our legislators to figure out how we can make sustainable solutions that aren't band-aids to our system. And so I'm going to talk about some real solutions that we can advocate on. There are some bills coming through Congress that we want to support. And we'll go into more detail about the specifics of each bill throughout the mobilization. But right now, I'm going to do a pretty basic overview. What I think is really exciting right now is that I don't think it's any secret, but there's not a lot of positive advocacy news coming out of DC these days. But patent legislation is actually one of them. There are a slate of patent reform bills that passed out of committee last year, and we're so close to making it further. However, earlier this month, those same patent reform bills passed again and almost entirely unanimously. This means the bills have the necessary bipartisan support needed to help them move forward, even during this time of massive political upheaval. And I really love that these bills not only address the many reasons why insulin is so expensive, but these bills help people with many diseases on many different medications. This helps all of us. These are systemic fixes to the problem. So I'm going to talk about the bills a little bit. If you have any questions, feel free to drop them in the chat. Like I said, we don't need to know all the specifics, but I love that they're pretty much addressing one-on-one the issues that Barrett just talked to us about. The first bill is S1040, and this bill addresses product hopping. And it would stop this tactic where drug companies take tiny, unnecessary changes to a medicine or to a delivery device, like a new color or a slightly different dose, just to keep their patent and and their cheaper generics from coming to market. These changes don't actually improve the drugs, but are used to extend monopoly pricing. This bill would amend the Federal Trade Commission Act to ban this practice. It's about making sure companies can't game the system so patients can get affordable medicines without unnecessary delays. The second bill is S1041. You don't need to know these numbers. For all the policy nerds out there, if you want to keep track, it's all there for your information. But this bill specifically would tackle patent thicketing, the strategy where companies file dozens of overlapping patents on the same drug to block competition and keep prices high. This bill would address the infringement of patents related to biological products. So that means medicines like insulin, the liquid sort of medications, and make it harder for companies to abuse the system. By reining in the patent thickets, we can open the door for more affordable options to enter the market sooner, ensuring patients get the treatments they need without facing outrageous costs. It's about putting patients first, not profits. The third bill, S1095, is called the Stop Stalling Act. And this cracks down on companies that misuse the citizen petition process to delay competition. Right now, some companies file sham petitions not to protect public health, but to block generic and biosimilar drugs from reaching the market. This bill would work to deter those tactics and ensure petitions are used properly to raise real good faith health concerns. And by stopping these abuses, this bill would help bring lower cost medications to patients faster and foster fairer competition. And finally, the fourth bill would address pay for delay. And this is called the Preserve Access to Affordable Generics and Biosimilars Act. And this would stop the pay for delays deals where brand name drug companies pay generic or biosimilar manufacturers to delay bringing cheaper alternatives to market. These secret deals, all happening behind the scenes, they're the ones that are keeping the drug prices high and hurt patients who need affordable drugs. The bill would ban the agreements, protect competition, and help make sure patients get access to lower cost treatments sooner. This bill is all about closing those loopholes and putting patients over profits. And our work also means that we want to stop bad bills from being called. Not going to get into it because we only have a limited amount of time here. And I want to keep us in direction, but it's important to know that there is work being done behind the scenes to confuse legislators on what is actually good solutions in the market. We all know there's a lot of lobbyists out there with a lot of money. And these bills were actually introduced at a similar time as these good bills. A huge number of members of the House are new, and many folks like you and me are probably not super familiar with patent law and what it has to do on insulin access and affordability. So the key is having people like you and I educating these members of the House of Representatives. And while we're at it, while we're talking about wonderful solutions that we need, we're also calling on Congress to act on a yet to be introduced bill on insulin copay caps, similar to what we saw last year with the Insulin Act. We've been a talking point for so long. For so many years, we've been hearing that we need change on insulin. And yet, despite bipartisan and bicameral support, we still haven't been able to pass anything. These sort of changes are something that we think can save the government money, which is what we're apparently all about right now. And I think most importantly to all of us, save lives. But we need to get it passed for it to do that. So we're asking Congress to pass a policy to cap the cost of insulin for people who need it now. You might also notice that patent legislation might lead the way to something like one of our other priorities, our work on public pharma. And this work is building that case to challenge the monopoly power that big pharma has over it. Patent reform opens this avenue for states, for the government, to publicly produce insulin and other drugs. By stopping these anti-competitive practices like patent evergreening, we are making these medications more accessible. By passing these good patent bills, we're not only changing the necessary policies, but building this runway for public production, a campaign that folks in states like California, Michigan, and New York are already working on. And we're going to be running a mobilization on public pharma in a few weeks, so you can stay tuned and kind of figure out, see how this interaction happens between patents and public pharma. I'm going to now check the chat and make sure I'm not missing any questions. Also, feel free to just come out off of mute. I do see a lot of shout outs to the policy nerds. Love you. Thank you for all of your work and service. Yes, we are the experts. Like, this is why we're here. We are training. We don't have to have a law degree in patent reform to really make the change that we need to see. And I think that is a perfect segue to passing it back to Shayna.
Well, thank you so much, Kristen, Barrett, and Cindy for sharing your stories, leading this fight on the patent reform work. As we've been mentioning on this call, we want to have used this webinar to inform, but really to take action. We know that patent reform is needed, and that the data and our stories show that these are good policies that will save money, increase access to life-sustaining medicines like insulin. But unfortunately, what we've seen over and over again is that facts alone don't change policies. If we could change policies just by having the right information, we would have done it by now, right? We know that in order to change laws, we use our people power by getting our voices together, by sharing our stories. That's how we get heads nodding and hearts pumping. And both in the halls of Congress and in the districts all around the country, to move constituents, to move members of Congress to be able to really take action. That's how we build the movement, and that's how we build power, and that's how we win our demands. So telling your story can be really hard work, but it's really important work. So what we're asking for folks to do is, the first thing that we're asking folks to do is to email your member of Congress. I've got the link all queued up and in the chat all ready to go. So sending an email to your letter of Congress through this nifty little tool. So if you click on there and then click on email your member of Congress, you can just put in your zip code and our system does the rest. We have a template email in there with all of the demands. All you have to do is share your story. All you have to do is put in there why patent reform is important to you. Why is insulin access and affordability critical to you? Then it'll automatically pull that into an email to your two senators and your member of Congress that you're a constituent to, with some specific language based on how they stand on these policies already. So that's really cool. Hope everyone is taking action right now. It's always a little, when you drop the link in the chat, everyone's like, all right, I'm just going to write my story up right now. But actually hold off for like 5 more minutes here, because I really want to talk to you about our patent reform mobilization working group that we're doing. So that's the second link in there. Our mobilizations are different from just taking one action, just sending a letter to your member of Congress. Our mobilizations are really a way to dive deeper and become part of a team. We're working together, getting our voices heard together to have this bigger impact. So we're going to be meeting every other week, starting next Sunday, May 4th, through the July congressional recess. So over the next couple of months, we're going to be building momentum. We're going to be taking coordinated, meaningful actions together. So when you join, you'll get training on telling your personal story in a more powerful, meaningful way. And we'll practice sharing our story in a couple of different settings. So we're going to be doing lobby meetings. Are you like, oh my gosh, I'm not a lobbyist. I bet I'm not the only one, but that we can all be powerful lobbyists to be able to share our stories in the halls of power. We're also going to talk about sharing our story in media interviews, in advocacy events, in writing op-eds, or other ways to get media. And then we're also going to provide support and coaching and a community and network of folks who are taking action together. So this is an application process. So if you're ready to grow your skills and fight for affordable medicines with a community of like-minded advocates, there's the application. And applications are due April 30th, so on Wednesday. at 5 p.m. Eastern time. So do recommend if you're interested to apply today. The first meeting again is next Sunday, May 4th. And so feel free to put any questions about that in the chat, any questions about any of this, really. We're going to go from here to questions. So start throwing those questions in the chat. If you're not able to participate in this mobilization, we totally understand. There is a lot going on right now. It's like it is a wild time. But there's other ways that you can support this movement. So first of all, can you donate? Giving a gift of 10 or 100 or $1,000 will do a lot to support this work. Unlike a lot of our peer organizations, as we said at the top of this call, we don't take any funding from pharma or from device manufacturers or from anyone who might influence our policy work. Funding is tight all around, and we really rely on individuals like you to support this work. So we can drop that donation link in the chat as well. And if you can't donate today, can you fundraise? Fundraising for T1 International isn't just about raising money. It's about fueling a global movement for insulin for all. So we have fundraiser. We can support helping you organize fundraisers to spread the word, build community, and just push us closer towards justice. So those are how we hope you can take action. Email your member of Congress at any time, share your story in the story links. Join our mobilization. The applications are due on Wednesday, or donate or to fundraise. So I'm going to pause here. I don't think we've been seeing too many questions coming into the chat, but I'm going to pause for just a moment and see if folks have questions that they want to put in. Oops, my link wasn't a hyperlink. I apologize. But I'm going to wait for one more minute here. Yeah, on patents, on the policy solutions, on how to take action.
I do see Stephanie messaging in the chat. I'll address that briefly. Not a great singer, so also this mic doesn't have the highest fidelity. But we can connect offline about that. Certainly. Yep, we can follow up with that on one of our next trainings.
So feel free to keep putting questions in the chat. Barry said any type of question's good. So there we go. I did just see a message. These are all Senate bills. Yes, these all passed out of the Senate Judiciary Committee. They are going to the House, and that is actually one of our big focuses as we're trying to see if we can get folks in this as part of this mobilization who are from key House districts, because it'll be going through the Senate and then it'll be going to the House Judiciary Committee, which hasn't seen these bills before. So we need to do a lot of education and supporting staff to support their members of Congress to take action on these bills. So great question. Okay, I'm seeing lots of concentrated faces, which I think means you guys are like writing your stories into the form to share your story with your member of Congress. It probably is going to take a few more minutes, so if you're working on it, you can leave it up as you're going. But I am going to just share. As I said, we're going to be sharing the recording and all of these links. So keep an eye on your inbox. And if you have any questions or would like to connect further, have any tech issues, you can reach out to us at usachapters@t1international.com. And before you go, I'm going to share one last poll. This time it's not a quiz, it's just a poll. But I'm going to put it up on the screen here. And you can tick one box or you can tick multiple boxes of just how are you interested in supporting this work? Can you email your member of Congress? Can you apply to join the Patent Reform Mobilization Working Group that's starting on Sunday, sending in that application by April 30th? Can you donate? Can you fundraise? putting that up there knows that we'll be able to follow up with you if we see that you meant to apply for joining the Patent Reform Mobilization Working Group, but we haven't seen your application yet. We can follow up. And just to make sure that we get those emails into your members of Congress, because that is a big, exciting lift. If you've never told your story before, we'd love to support you in getting those emails in. It's a really important way of showing our members of Congress that we're following this work. So the last box in there is for feedback. So if there's anything else that you want us to know, any feedback about this webinar, this can be on the delivery, on how the information that was presented, the calls to action, anything that you want to share that went well, that could be improved, something that you learned, or anything else that you want us to know. We really take this, feedback about these webinars seriously to really help us improve and shape future sessions. So that is that last poll up on the screen. I'm going to leave it up for a few more minutes here. So yeah, thank you again so much. We really look forward to working with you and seeing you all at our next event. Our next webinar is going to be a month from tomorrow. May 28th, we'll be releasing our out-of-pocket expenses survey. We can drop that link in the chat as well. And then again, on that link for t1international.com/patent reform is where you can get all of the links for the materials that we shared today. And we'll be sharing those out by email after this as well.